on page, here it's on page 37 in your textbook. This is just something you can go through and review. Nausea, vomiting, a lot of irritable bowel syndrome, type tremors, shaking, diarrhea, difficulty breathing, dry mouth, headache, sleep disturbances, vision issues, anxiety, denial, fear, panic, anger, numbness. Okay, increase or decrease in activity, withdrawal, silence, crying, suspiciousness, change in appetite, increase in smoking. I think we've all seen that one. And then difficulty making decisions. A lot of times, cognitively, we'll have kind of like a freeze up because it's just poor concentration. Some people here in this phase will cite the every time they make a decision, something bad happens, so they don't want to make a decision anymore. Doesn't mean they're making bad decisions. It's just we work in EMS and bad things happen. When we make decisions, it's just sometimes good happens, sometimes bad happens, but it can freeze people. Going back to our cumulative stress, remember that's repeated exposure of stressors over time. When stressors continue, individuals enter exhaustion or burnout. Okay, this is a huge issue. Here are your cumulative stress burnout type symptoms: fatigue, headaches, GI problems, changes in appetite, joint and muscle pain, poor memory, disturbing dreams, difficulty making decisions, anxiety, boredom, apathy, emotional exhaustion, loss of emotional control, feelings of guilt, depression, paranoia, suicidal thoughts, irritability, smoking or alcohol intake, decreased food intake, withdrawal of substance abuse, or avoidance of responsibilities. These are all signs of this. And it's not listed here in your book, but you can Google cumulative stress disorder, and you can kind of see how some of that stuff goes. There's actually an article in GYMS this month, August 2015, that talks specifically about burnout and what they call empathy burnout. It's a very good article. So if you have a copy of the August 2015 version of GYMS, go ahead and pick one up and read about it. So, whereas burnout is an accumulation of low stressors over time or repeated acute stressor events, and acute stress events are something that generally occurs 2 to 3 days after the event or immediately right after the event, PTSD is something that is an acute stress reaction, but it's delayed. It's something that you don't notice for weeks, days, or even sometimes years after the event. PTSD has very similar symptoms to all of those things above, but is much harder to treat. PTSD can very much interfere with normal behavior. There's a lot of veterans that have PTSD, but also paramedics and EMTs can have PTSD too. And then here are your signs and symptoms, and again, very similar to your cumulative stress thing. Again, with the fatigue, the headaches, the GI problems, changes in appetite, joint and muscle pain. Again, with the poor memory. Again, with the difficulty in thinking and making decisions. Again, with the anxiety, the boredom, the apathy. Again, the difficulty in interpersonal relationships or emotional loss of control, feelings of guilt, and the depression. Again, with the irritabilities, increased alcohol intake, withdrawal and avoidance, and substance abuse. So it's very, very similar. You do have a couple things that are a little bit different. This says paranoia here. This says flashbacks. That's a good one. That's not the same. Your book doesn't mention it, but you do get some nightmares with the cumulative stress as well. So here's some less helpful coping mechanisms that people generally do. They'll deny or refuse to accept what has happened. They'll act out. They'll yell. They'll hit. They'll run away. This is in the kind of the short term, or they'll trivialize. They'll make light of a situation to avoid inappropriate humor. I don't know anybody in EMS who's ever used inappropriate humor to deal with a problem. Intermediate mechanisms, displacement. They'll place the blame on somebody else, or they'll rationalize their feelings out of context and isolate them. After the event, sometimes you'll go through what we call reaction formation, where you start to suppress feelings that you're not comfortable with and only express the ones that you are comfortable with. And then you have workaholic type behavior and escapism, where you just put yourself and you throw yourself in all these projects so you don't have to think about things that have happened to you in your life. As things go around and we have more mature mechanisms, as we get further from the event, we'll have suppressing. We'll consciously try and put things out of our mind or distract ourselves. Or we may try and actively seek a positive way to improve the situation. Obviously, this is what we want right here. We want this. We want active problem solving. That's a great way to handle these situations. Believe it or not, motor vehicle safety is the biggest concern. This ambulance here is obviously upside down. Upside down is usually bad. You can see there's a lot of damage here to the frame. Looks like there's damage here to the driver's side. I don't know if that's where they cut open for extrication. Usually when ambulances are upside down, that equals a bad day. This back patient area has held up surprisingly well. Usually what will happen is this is like a plywood type thing, and it'll just kind of go and just explode all over the place. So this is what we call a bad day. This can cause, of course, post-traumatic stress disorder. So some common stressors we deal with in EMS: issues with work hours, workload, and pay. Obviously, we don't get paid a whole lot. We work a long time, and we work a lot when we do work. Conflict with coworkers or supervisors, that's common anywhere, but anytime you put people in these high-stress situations, all the time these conflicts are going to come out. Frustrations with other drivers and the general public with not responding to how they need to do. You may have confrontation or difficult patients, and you may have a fear of making the wrong decision or making mistakes. So these are all very common EMS stressors that tons of people feel in EMS, especially the confrontational or difficult patients. And then when you're new, these fear of making mistakes or making the wrong decision that can impact people's lives in a negative way is also something that you have to contend with. These are some of the more difficult calls that we have to deal with on a daily basis. And I know we're all experienced providers, and we have a tendency to kind of have this machoism about this kind of stuff. But these are stressful events. Calls involving dead or dying patients, especially the dying patients. At least for me, I have, this is not the most fun situation to be in here. When they're already dead, you kind of can distance yourself. But when you actually have to talk to them right before they die, it can be a little troubling at times. Abuse and neglect, especially for your pediatric patients, like your children, but the neglect cases in your kids, very concerning. Multiple casualty incidents. Anytime you have large numbers of people yelling and screaming at you, it's always a bad day. Coworkers, injury or death of coworkers is a big, huge deal. And seeing such disfiguring or traumatic injuries. Some people really aren't bothered by this. Some people are. And that's okay if you're one of those people that are bothered by seeing this really gross stuff. And I don't happen to be one of those. Those people. So seeing really gross stuff really doesn't freak me out too much in person. Watching it on YouTube bothers me. I don't know why, but if I see it in person, I'm fine with it. But there are some EMS providers that have issues with this type of thing. And, that's okay. So mental health personnel, we're talking about counselors, social workers who do counseling, clinical psychologists, primary care physicians who may do a little counseling on the side. They play a critical role in response to disasters. They come in, they help out, they talk to us, they counsel us after high stress-related issues and help us through our stress-related symptoms. Help and develop effective coping strategies as well. So these are some aspects of physical wellness that we need to keep track of. Of course, disease and injury prevention. How we prevent injuries is making sure that our homes are safe. We have non-slip padding on our bathtubs. We have rails and things to grip onto. We exercise. That'll help us recover from injuries and diseases. We get adequate amount of sleep. We're supposed to sleep about 8 hours a night. I usually sleep about 7 or 7.5, but sometimes that just isn't possible, especially at the firehouse. Of course, we want to maintain a healthy body weight. We want to be below about 25 on our body mass index. Maintain good nutrition. Eat right. Eat healthy. Try and make your dinner plates colorful. Is what they tell me. I actually diabetic. I'm a type 2 diabetic, and I had to go through nutrition and all that fun stuff to learn how to eat. And one of the things to say is if you look down and all you see is brown, you've messed up somewhere. Try and make your plate very colorful. You want lots of vegetables, lots of fruits. Lots of, well, not fruits for me because those are high in sugar, but lots of vegetables and try and get lean meat like fish or chicken. Try and stay away from the red meat a little bit. You can have it, but try not to eat nothing but red meat. And then, of course, good physical fitness. Exercising, not just cardio, but also doing weightlifting. You need the weightlifting to help with bone density. It's going to help you as you get older to maintain that good, strong physical fitness. So some challenges to our safety, of course, motor vehicle collisions is one of the largest killer of EMS professionals. Actually, it is the largest killer of EMS professionals. Back injuries, of course, but probably about 64% of all EMS workers will get a back injury in some point in their career, minor to severe back injuries. Usually your first back injury is going to be a minor injury, and then it progresses over time as you hurt your back more and more and more. It becomes a bigger deal. What will happen is your muscles will get weak over time, and eventually you'll wind up with a ruptured disc or something of that nature. Violence, yeah, we encounter a lot of violence in the field, but typically speaking, we don't have a lot of injuries from violence. But it is possible, and it's becoming more and more prevalent. People are becoming more brazen. They're not respecting so much public safety like they used to. Not that they used to respect public safety, but even less they're respecting public safety. So violence is becoming more of an issue for us. And exposure to communicable diseases, of course. Communicable diseases is always a constant threat to us. That's where our vaccinations and good personal hygiene come into play. Sleep disruptions and unusual schedules often affect the health of the EMS provider. There's been studies that show that fire-based EMS systems have higher incidence of cardiac arrest in their employees, and they think it's got to do with the way that the tones go out at night. There's been some studies showed that the average age of death or firefighter is about 55, 57. And a lot of times we think it's the station food or the poor diet, but they're coming to think it's not just the station food, but it's also the stimulation from being woken up from a dead sleep by loud screaming alarms. Of course, lack of healthy food choices doesn't help. And then long periods of just sitting around not doing anything, sedentary activity. A lot of times we're posted up in a truck or we're sitting at the station, we're not doing anything, and that leads to obesity. The most common cause of severe injury, of course, like I said before, is motor vehicle collisions. MVCs caused the most traumatic deaths on people under 40.